Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athlete trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's story episode, we are going to be talking about what some have referred to as the beautiful game.
Soccer.
Yes, that's right.
Actually, am I going to out myself as not working soccer that much for not knowing that people call it the beautiful game?
You know what? I feel like not many people, I don't know, I feel like you don't hear it as much referred to that anymore, or at least in the States maybe. Maybe it's not like a US thing, but yeah, that's a classic, what people refer to as the world's game.
Maybe. I know you are, soccer is like one of your favorites, if not your favorite sport to work.
Absolutely. Every time we talk, like we watch a game or we talk about it, I'm like, I miss working women's soccer.
So between Randy and our special guest, we put together an episode for you with literally, I think, the two most passionate people about soccer in general. Today we are bringing on co-host Lorena, who is also my co-head athletic trainer at the college that I work at. She's been working soccer for so long, and she was a soccer player herself. So she has so many tidbits to learn from, some things that I've taken into my practice. Randy's probably taken as well.
For sure.
Even though I don't work soccer that often, which you can definitely tell in the episode. Fall is football for me.
A different football.
Yeah, it is. It is. So anyway, we go over some awesome soccer memories, kit must-haves, advice while working soccer, some return to play kind of stuff, and we finish up with everyone's favorite, injuries.
Of course. Yeah, you gotta finish with something cool.
Duh.
We even have a cool one from Kevin, by the way.
We do.
Snuck
we
in
do
there
have a cool one from Kevin.
And a gem from Jen. We got
the
some
dynamic duo.
Yeah, we got some good stuff packed in this bad boy.
All right, Lorena, in true soccer fashion, could you please kick us off?
Sure, I won the toss. I'm ready for this. Let me tell you about my favorite soccer memory. By soccer memory, I think it's really great that I've had such a great and successful career where I had to really think about what was my favorite soccer memory. I've won state championships. I've seen many people return to play, but there are two memories that really pop out in my mind, honestly. One's a personal and one's like a professional. So we'll go way back into time. There was this amazing player on my women's soccer team that embodied everything that a captain would be and should be. She was there for her teammates. She was a vocal leader on the field. And honestly, she had a great junior year. She was a fifth-year senior. She had already had a medical redshirt year. And we were just really looking forward to the season. And I remember I was up helping my dad do some construction. It was August, right before camp started. And she calls me and tells me that she tore her ACL. So fifth-year senior, this is the reason that she had stayed at the university. And I just took like a moment, and it was really hard. I think they were supposed to start camp literally the next day. And I knew that she had to be like a vocal leader and be off the field. Well, we decided there was an idea put in our head that, hey, like, do you really need an ACL? Maybe I could just play in my senior game. But what we did is we worked in and out, day in, out on getting her strong, getting her proprioception up. And we approached Doc about, I think, around like a month before senior game. And we're like, hey, Doc, like, maybe she could just like kick off. Maybe she could just, she's usually a defender, but, you know, can we just put her up top? Can she just run around? Can she be there for her team? And surprisingly, Doc said, yeah, let's go ahead. Nice and simple. Go up top. And I mean, she was doing some dynamic and functional stuff in the athletic training room. And this, like I said, and everything that captain embodies, this is who it was. She worked hard. So we had her start her senior game. And as both of us like to say it, 67 minutes later, she played for 67 minutes up top, 2 shots on goal, worked herself to the bone. And it was a 0-0 game. I think the coaches had decided, hey, we might actually want to try to win this game. Let's go ahead and pull her. Let's go ahead and pull her out. And it was right after she had literally like made a shot on goal. And you could tell that she had left everything on the field for her team, for herself, for her career. And she got subbed off, and the first person she came directly over to me, gave me the biggest hug in the world. And she said, thank you. I really couldn't have done this without you. And I'm sure I can't remember the exact words, but this was pretty soon in my career, pretty early in my career. And it stuck with me. I mean, I've had athletes thank me, but nothing compares to watching her under the lights, kind of Friday night lights on the stadium, and just playing her heart out. So it stuck with me all the time. I talk about her all the time. Yeah, so that was professionally one of my favorite memories. And then fast forward to just last year, for so long, the college that I work at, we've only had 2 athletic trainers, and my men's soccer team always goes up to SRJC. And Santa Rosa Junior College holds a special spot in my heart because the SRJC is where I played soccer. It's where on day 1 of the fall semester as a freshman, I walked into this intro to athletic training class or sports medicine class. And this guy, Byron Craighead, head athletic trainer at SRJC at the time, walks in and tells me for the first time what an athletic trainer is and what an athletic trainer does. And I fell in love with the profession. So I played soccer at SRJC. That's where my passion for athletic training was. And this past year, about a year ago, men's soccer was going up to SRJC, and they were going over my birthday weekend. And because we had hired a 3rd athletic trainer, I was able to go on that trip. So on my birthday of last year, we played at SRJC. The athletic trainer up at SRJC, Monica, brought me to the athletic training room where it started all. And my guys won the game. We did pool rehab at the hotel, had a great day, went out to some taco trucks, and I just had a great day. And it was like coming full circle. 20 or so years after I'd left SRJC, we got to win a game against SRJC, but also I got to see where it all started. And I think those 2 memories, on top of all the ones I've had, those 2 stay on the top.
Nice. That's pretty cool.
You know, it's a really special case for someone who could play not just in their senior game at all, but for 67 minutes without an ACL.
Yeah.
Well,
she
I
was
love
a special
how
individual.
Yeah, I was gonna say I love how it always, how it always goes. Oh yeah, you're allowed 10, 20 tops or 15 tops, and it turns into 67.
I think all of us were just standing back and just in awe of how she just still commanded it. Captain by captain, we just loved watching her play. To this day, it gives me chills, and there's nothing that's ever compared to that moment. Just seeing, I mean, we've all had the moments where we've returned the athlete to play, and we're a little nervous. We're like, ooh, like going in for that tackle and everything, but I don't think I was nervous. I was just in awe of this amazing individual and the hard work that it took to get there. And, Doc, we thought, 10, 15 minutes, whatever, she could go, but she was playing just fine. I didn't understand it. I think it was just meant to be.
For sure.
So,
Randy, do you have a favorite soccer memory?
I have to say it was probably the last year that I worked women's soccer, because that year we won our conference championship, but that was coming off of a year where we had benches thin. Like we had 13 ladies left at one point in the year. We had to forfeit a match because 3 of the ladies carpooled together, got in a car accident, all got concussions.
Oh gosh.
I had 5 knee injuries. 4 of them were surgeries that year before. So that next year, like actually having like such a great year, a great group of ladies. It was a really fun dynamic. everyone bought into the system that we were doing. So it was a great year, and we played a really tough team too for that conference championship game, nationally ranked, I believe, or at least they were highly ranked in at least in our conference. And it was crazy. And it ended up, I think the score was 1-0 for us. And those last 10 minutes were probably the most stressful 10 minutes for everybody, because naturally the other team's pressing so much that they're getting opportunities and you're just holding your breath that hopefully the defense holds.
That's how watching soccer is.
Yeah.
It is.
So it was a really cool moment, and that probably still to this day one of my favorite teams of all time.
That's
and that
really
final
awesome.
whistle could not come soon enough.
Could not come when the ref blew the three blows. It was great.
Yeah.
So we
Pointing towards
did
center circle,
get
we're
a
done.
story from Evan J. He said, my first year last year, my team scored with 3 seconds left in the final game of the year to clinch the regular season conference title. One of the greatest sporting moments I have ever witnessed.
No, nothing like it.
Oh my gosh. That's why you gotta love soccer. It's a game of goal. Not goals, but a game of a goal.
Yeah.
It really is.
And the level of relief everyone has at that moment, and just like, oh, thank goodness.
Actually, one of the great things about soccer is just literally like that whistle blows and you see the spectrum. You see half the team just collapses in defeat, and then the other half of the team or the other team collapses in celebration.
Yeah.
You're like, this, like, I don't know. I think it has something to do with that whole 90 minutes of straight running a little bit, running a 10K. I don't know.
Just a little bit.
I think just people are just excited for it to be over.
Honestly, I think that pairs really well into the must-haves in your kit when working soccer. I'm going to share what we got from our Instagram poll. But I'm going to actually, before we do that, I want to hear from you, Lorena, first, what your must-haves are in your kit when you work soccer.
I mean, you should always expect blood. So obviously, but I'm a big fan of the top sponges. Don't give me any non-moving stuff, or don't give me that other gauze. I'm gonna soak up some blood. So having good gauze, having those top sponges.
That is the number one answer, by the way. Gloves,
great.
gauze, or a towel. That was number one answer.
Okay, great. Yeah. Also go along with that, if you're in your white uniform, everybody has their thing about what do you get blood out with and everything like that. And I'm a huge fan of contact solution. It comes out in a spray. It goes right through the blood. It does
Nice.
It does a good job. But another must have, there's a tape from 3M. It's called Microfoam, and it's a spongy, stretchy tape. And it works well for going around toes. We all know that cleats don't have any room for tape, really. So it smashes down really nicely, but it provides a little bit of padding. You can go around toes. I put it over everyone's favorite blisters, old cleats, new cleats, your friends' cleats, everybody borrowing their other people's cleats. You're going to have blisters, so I think you become kind of a blister master if you work soccer. So the microfoam tape works really well. I also like Luco tape because I use it to fix people's cleats.
Yes.
Everybody, yeah. When they have little blowouts on the side of their cleats, or at the toes of their cleats, and then I think my crowd favorite. This was probably 7 years ago when somebody first saw it, or actually, if you watched the last World Cup, when a Netherlands player got a head lack and they used a swim cap. I've had a swim cap in my athletic training kit. While working soccer for the last 7 years. I'm not excited to use it, but I'm kind of excited to actually use it at some point, especially if somebody has a lot of hair, if you're working women's soccer or even men's soccer, those head lacerations. As we know in soccer, substitutions don't necessarily happen all the time. You get them off the field, pack it with gauze, put a little bit of tape on it, throw a swim cap, and it's good. And, you're not doing any bloodborne pathogens. You're not spreading blood all around. It probably messes up their headers, but say the swim cap is a crowd favorite for me.
I think they rather play than with some messed up headers than not play at all, or take a long time to play.
It's a pretty decent look too.
It is.
Okay, I'm a little bit surprised that you didn't mention any cramping supplies. That was our number 2 answer.
Yeah,
electrolytes.
Cocktails.
Yep.
I forgot about that.
That's what I was totally expecting you to walk right into that one. I think you should tell everyone about your electrolyte cocktails, by the way.
Okay. Well, no patent pending because I learned this from one of my peers. But my electrolyte cocktail is Alka-Seltzer Gold, so it doesn't have the aspirin. So 1 tab of Alka-Seltzer Gold, 1 packet of Gatorlights, and then because I don't hate my athletes, some Gatorade to make it feel better or to make it taste better. And then you just tongue depressor, the all-purpose tool that we all have, that we never know what exactly to use for, but for electrolyte cocktails works for me. And just stir it around and have them shoot it like a shot, or just tell them it's going to taste like you lick the bottom of the ocean with a little bit of a Gatorade chaser.
Tell us what the Alka-Seltzer's for.
The Alka-Seltzer helps to the absorption of the electrolytes. So I've been told. Who knows? This might be true or not. But I've heard like the bubbles and everything like that will help with the absorption of the Gatorade solution and the Gatorlight solution. Seems to work for me. And when that's not working on the cramps, I go for the makeshift cold spray, right? Everybody has cold spray in their kit. If you work soccer, I've heard.
Actually, that is tied for number 2. We have gloves, gauze, towel was number 1 answer. Number 2 is cramping supplies, tied with cold spray and biofreeze.
Yeah. So actually, I don't have cold spray, but I learned this trick from somebody else. Biofreeze, you spray biofreeze, take a bag of ice, and do an ice massage with biofreeze, and it actually works really, really well. It's like it's like a spicy cold spray. So yeah, those are kind of the must-haves in my kit.
Randy,
I feel like I have a lot of must-haves.
Do you feel like cold spray was something that your ladies used a lot?
No, we never really used it. I don't know. We never had it.
Mm-hmm.
And like, I've never been in a position where I needed it.
Mm.
Like, I don't know. I felt like we did fine. Like, we did well without it. So I never really felt like, oh, we need to buy cold. If anything, I'd always want it kind of as a joke, just because it's the magic spray you see on TV.
Right.
You turn on the World Cup, someone's pulling out the magic spray.
Yeah, well, actually, Randy, you might have seen on the last World Cup, I believe we were all trying to figure out if the orange slices were the new cold spray.
Yeah. I was intrigued by that.
I've talked to multiple people about this. It looked like there was some orange slices being like rubbed on or given, not necessarily to eat to people, but I think that was really interesting. I want to find the science.
I want to know what it is.
That one. Yeah, they look like orange slices. I don't know what the heck that was, though.
I want to know what the product name is. I'm very intrigued.
It's product placement. That's what it is.
Yeah.
Maybe
another one need to get on that.
Is electrical tape for shin guards.
Yeah, that's fair.
We got a lot of that, and stuff for blisters, second skin. Actually, it was funny that you mentioned that, Lorena, because I used to buy my own and use my own microfoam tape in my point shoes.
Oh, that's cool.
Oh, really?
Luca tape. Mm-hmm. That's what I used to use
the Luca tape
for blisters.
Sticks to anything that would make sense.
Right.
Not many people have heard of that microfoam tape. I feel like I've been using it for like 15 years for my previous job and everything. But it comes in the little inch, and then you can get, I think it's the 3-inch or the 4-inch, and it's so versatile. I'm a really big fan.
The last most popular one was foam roller, lacrosse ball, massage gun, something of that sort. And then we had a couple runner-ups. Scat 5s, baby powder for chafing, and hair ties were all runner-ups.
I was going to say, along the lines for the hair ties, I would say, if I'm thinking
pre-wrap.
Everyone
uses pre-wrap.
For mine, and especially because, I worked women's soccer. Like, the pre-wrap was, I had to load up on the pre-wrap.
Yeah, Alex Morgan really helped us with that, with the pre-rep headbands, and Rose LaValle still sporting it.
Yeah, Leuco tape. Yeah, I'm a big fan in general of that. For me, I felt like I used nose plugs the most with soccer. I feel like I had to pull those out all the time.
That's what Lena H says. Nose plugs and mustard/pickle juice. I have an absurd amount of bloody noses in soccer, and they cramp more than all my other sports combined.
Yeah, I did have a lot of bloody noses too.
Yeah.
And of course, it always would occur on the white jerseys.
That's how it works.
Yeah. Where I currently work, luckily our home jerseys are the darker jerseys. But this past weekend, we traveled out to an away game, and I went with them to the tournament, and they were wearing their whites. And I'm pretty positive whatever their white shorts are made of, they're built different, because I was trying to get blood out of that. One of my guys had a turf burn, and it had just started bleeding like crazy. At one point, had to ask him, all right, stand behind the bench and just hand me your shorts, because the blood, it's like a crime scene.
It's because you need to come over to the hydrogen peroxide team.
Yeah. Well, this is the first time that like my contact solution was not working. But literally it would work, and then I'd rub it, and it was like those little the coloring books where you start to rub and then all of a sudden there's color. I was like, there was no color there a second ago. Why is it every time I like rub this material? So the hydrogen peroxide, I don't know. We'll have to see. I'm not quite convinced. I know it works, but I kind of like the whole like spray thing.
We did get a couple of blood stories. Jayde C, while I was working my very first soccer game as a new certified, all was quiet until the very last 2 minutes of the game. A few athletes jumped up to head the ball, and a second later, one of them was running towards me holding his face. There was so much blood on his face and his mouth, it was difficult to even know what I was looking at. Once I got some of the blood off his face, that's when I saw he had completely bit through his bottom lip.
Nice.
Thankfully, his parents were there, and the athlete was cool as a cucumber the entire time. I packed the inside of his lip with gauze and steri-stripped the outside. I advised his parents to take him for stitches, but his father waved me off and told me super glue will do just fine. To each their own. Teenage boys think scars are cool anyway. LOL.
There you go. There you go.
I mean, if you haven't seen someone bite through their lip, like, have you really seen anybody play competitive soccer?
Okay, so I didn't put them in here, but 2 people submitted stories about 2 people going up for a header and losing their tooth in someone else's forehead. 2 people. Nice. 2 people.
Wow.
Crazy.
I've seen crazy teeth marks on someone else's body from the other person's, like a nice dental impression. Mm-hmm. And actually, I've had someone have to go to urgent care a couple days later after someone left a dental impression on their arm and it got infected.
Oh, like, love that.
Did you not wash that? Or do I need to check that other person's mouth for? Well, who knows?
Seriously, any bite marks, you need to get that cleaned.
Yeah. There's definitely a thing for that.
So have you had it where 2 players go down at the same time?
Yes, actually, it's been about 72 hours. The last soccer game. Luckily, there was another athletic trainer there and everything like that. But typically, I will have at least one student with me when I'm working soccer currently. So if we do have to divide and conquer, I have had just one student with me, and I've gotten the trifecta, and not like women's soccer trifecta, like a true like 3 people down. That one was really interesting. And that's like a quick triage. Luckily, one of them seemed to get up pretty quickly. But yeah, the 2 people go down. I always tell my student, I'm gonna send you to the one that can talk, and I'll go to the one that doesn't seem to be able to talk as much. Because that's my quick triage. Is that person talking? That person looks unconscious. You go over there, and then I just tell my student basically if you can get the other person that went down to come close to me so that I can at least be seeing what you're doing. But yeah, that's always good. I mean, in soccer, you get so many people, like 2 people going up for headers. It's crazy. Like on the set pieces, any ball that goes into the box from the corner or from like the 30 yards out or whatever, there are probably 6 people going up in the air at any point. So set pieces seem to be a really great time for 2 people to collide. You'd be amazed. Like everything else, they seem to avoid it, but I've had a lot of scary set pieces, injuries and stuff like that, or something that looked kind of scary. Luckily, nothing's turned out too bad, but those set pieces, whew.
Yeah, you know what, and that actually ties into one of my favorite. I'm glad you brought it up. Was where I was at before. We didn't have students, so it was just me on the sidelines, and I had that one time. It was our girl and then the opposing team, and so they're both down. I ran out there, and again, this is just how much like how great this team was, because I could tell the visiting athlete was probably in more discomfort, so I went to her first.
Did they not have an athletic trainer?
No,
because
they were traveling to us, so we played host.
You guys didn't travel?
Not at that level, just because staffs are small, so it's really hard to travel. And this is how great that team was. As I ran to the opposing athlete, because she looked like she was in more discomfort, I was asking my athletes, "Is she good?" And they had her for me. They were like, "Yeah, she's her." I'm like, "All right, cool." So that was a pretty cool memory for me, because my team had it.
I feel like it's the moment, like when I watch football, and you're like, "Okay, somebody get up. Get up.
Yep.
You see 2 people collide, just get up.
Yeah, that's what it is.
Sanders sees it all the time in football. Come on, everybody get up. Everybody get up.
If you stand next to me, you just hear me going, "Get up, get up, get up, get up."
I have, yeah.
Honestly, I think soccer is so underrated in the amount of danger, I guess. Because it has a lot of contact, and there's not a lot of protective equipment. Actually, no protective equipment.
That's fair.
It's basically 90 minutes of possible collisions. At least like football's predictable, and there's whistles in between the collisions at least. And you know exactly kind of who's going to collide.
Right.
And
I mean, even the shin guards
correctly
are getting smaller and smaller.
Oh, yeah. I ask my guys all the time. I didn't understand if Baby Gap sold shin guards until recently, but apparently they do. I was just talking to my students about this past weekend, and honestly, you can't even tell when people are wearing shin guards anymore, because it just looks like socks. And no joke, they have officially gotten to less than the size of a deck of cards.
Oh my gosh.
Like one of my soccer guys, I think it was literally like 3 fingers, like my 3 fingers, that was his shin guard. And I said, if you get hurt, I will remind you of this moment right this second. Because it always seems to be that they get kicked in the shins.
Like, I get, okay, it annoys me in football, obviously, when the guys don't put their knee pads down. I know that it has to do with like mobility. Obviously,
it doesn't look cool.
No, it doesn't look cool, but like, the officials all like try to enforce it, and none of the guys put their knee, whatever. But I get it to an extent, but I don't understand. Like, does the shin guard have some sort of mobility issue? Because I can see how the knee pads like come down over the knees, you know.
Yeah. Do you want to know the answer? If you ask a soccer player,
yes,
I'm lighter. It makes me lighter. If I have small shin guards, it makes me lighter. I was like, it doesn't make that much of a difference. It's like ounces. And they're like, no, seriously, like, I feel lighter. And I said, great, cut your hair. If you're trying to cut a couple ounces. I don't know. Take off that chain. I don't, like, it's so ridiculous, because it's not like, I mean, shin guards are basically like plastic and a little bit of foam. Like, you're not wearing cement boots here.
Right.
Yeah, so the baby shin guards, I literally just talked to my guys this weekend. I was like, you guys are ridiculous. And when you go down on the field and you're rolling around, if I have to go out there and you say my shin hurts, I'm gonna just sub you out on principle alone.
I have to share this blister hack from Kevin.
Okay.
This is a cool one from Kevin.
Cool one from Kevin.
So he said, a bar of soap to rub on your socks to help prevent blisters from new boots. Rub the soap on the outside of the sock so it creates that barrier. This allows the sock to slide easier over the shoes and reduce friction in hot spots.
That's crazy. That's cool.
Yeah, I've heard that one.
I've never heard that one.
I've never heard that.
Actually, when he said it, I thought it was like soap in the socks, and I was like, oh, okay, I could see that. Because like that's the same idea like when I do Leuco tape like straight on the skin to just like basically make like a second layer to just slide over. But he was actually saying on the outside, so it just like goes, so it slides in the boot.
Yeah. It also like kind of feels like the fibers like of the sock. You can like it kind of fills the fibers, so they're not individual fibers that are like going. It's like a smooth surface.
That's cool. Hey, have you ever had any of your athletes try to break in their boots with the hydroculator?
Oh gosh.
No, I have not.
Really?
No.
This doesn't happen often, but I've had some guys put their boots in like an ice bag, and then they put it in the hydroculator, like not in the water, but like you know how like it has like the metal rack in there. They'll put it on that, and then they'll let the heat and the steam kind of like break in the leather a little bit.
You just tell them they can use the blow dryer.
Yeah, but the hydroculator is cool.
It's raining on their parade. A hair dryer. I don't have a hair dryer. Borrow your mom's. Wow, no, Randy, I have never heard that.
Yeah, it was interesting
to me. My
guys
just tried to break them in the old-fashioned way and just put them on their feet and try to play a game in them.
It makes sense. Makes sense. That's the best time to wear a new one.
Yeah. Oh my gosh.
All right.
There's been a couple of times where blisters have gotten in the way of people playing for sure.
Okay, next thing we have from Maddie S. She just kind of gave like an overview. I think this would be perfect right before we talk a little bit more about like soccer specific return to play and stuff. So she said, if you go on the field, the athlete has to come off with you no matter what. So don't worry about bringing a bunch of stuff for you for the eval, just the basics. Keep emergency stuff on a golf cart to drive over to them. A ref is always going to ask you if you have a wet bulb globe thermometer on a hot day. It's also easy to get confused about when you're allowed on the field, so listen to your gut. If you see something, just go. Working a big tournament is different than working the day-to-day soccer. I've done both. The tournaments are basically perfect for emergency prep if you're a new grad. Their shoes are so small and tight, they want everything as minimal as possible, and you will need good shears to cut off their cleats because there's no way you're getting that thing off without hurting them if their ankle is hurt already. And with any sport, learn it as much as you can. It will help your rehab, treatment, and prevention planning.
Yeah.
Thoughts?
Spot on.
Actually, one time when I was working soccer, there was a collision. This is a while ago, so I'm trying to remember what exactly happened. There was a collision, and I remember thinking like, oh, this is something I want to go out on, but it wasn't something like I had to immediately like run on. And all the sports that I work, except for kind of basketball is a little bit weird, but I feel like all the rest of them, I can just go whenever. So like I am not usually like paying attention to a person that tells me if I could do my job or not, which is like super weird to me. But anyway, so I was working the soccer game and I'm like standing like across. So I'm getting as close to the injury as I can, waiting for the official. The official calls me on and I start doing my little jog and then they put their hand up. And so then I just stop in the middle of the field. And I remember like just standing there and thinking, okay, I'm not really sure why you put your hand up. And I think that's directed towards me since you just like waved me on. And then like now you have your hand up kind of in like a stop motion. And so I remember standing there and then being like, and like I'm halfway, I'm not even close. So I'm just kind of standing there. And then finally the it was actually the visiting team's player. The coach yells, "Do you want the athletic trainer or not?" And then the official like looks up and then like waves me on again, and I was like, okay. Gosh. And so then I like run over and I was like, oh, thank goodness for that coach, because I was just kind of standing there awkwardly, like, I mean, I guess I could have yelled, but I just kind of was like in this awkward point of like they're kind of looking at him and like I'm just kind of standing here. It was just really awkward moment.
Really bad game of red light, green light.
Yeah, seriously.
Except you're like, I don't even know what light it's about to turn.
I know. And then I was like, I don't want to go out there because, especially because it's the visiting player, they're going to have to come off. I don't want them to be pissed off at me because they like, if they said to stop and I didn't, and I still went out, like it was a whole thing. That is like so stressful, especially like if, okay, the whole flopping thing. How do you tell when you need to run on the field?
I think the number one thing I always joke about, but it's true, is I do joke about this like every single time. If they roll more than twice, they're faking it, first of all, right? If you're actually in pain, you're not trying to roll around. You're trying to brace and stabilize and everything like that. There's also just from years and years of experience, and my students ask me this like question all the time, Sandra. It's the way that they yell, right? Like, there are certain sounds that guys would not voluntarily make, and that might mean that they're actually hurt, right? So I think it just goes with like experience. With the other team, you don't really know, but like with your guys, you could tell like, oh man, this guy falls like all the time. This guy is always going to try to get the other team yellow carded. Yeah. As the game progresses, you're going to see the people who lettered in diving, right? They were a second 2-sport athlete and they lettered in diving because they're so good at diving and they're so good at like picking up fouls. I think it just kind of goes with sometimes the gut feeling and just give it a second. I think when you're talking about going on the field, if the number one thing that like besides if I see like blood, bones, and unconscious, the number one thing is if their teammate looks at them and waves me on, that teammate looks worried for a reason. And like I think that's one of the keys is if you ever see like a teammate like walk over, or a couple teammates, like if they're just kind of looking at them and like walking away, they're not worried. But if they see something maybe that I can't see, or from their angle they saw a body part go a different direction than maybe I could have seen, I think the number one thing is you look at the teammates and then you look at the ref. The ref is the last person that wants to make any decision. If you see a referee or a teammate look worried, you're not waiting. You're just going to go on the field. And then the obvious, like blood, bones, and unconscious kind of thing. But yeah, that's what I would say.
Yeah, I was gonna say that's usually a good barometer for me. Is if my ladies were like starting to wave me, I was like, oh no, this is legit.
Yeah. That's when I'm like, you're gonna get more than a courtesy jog right now.
Yeah, and then same thing. Like when the ref is like pretty quick and like, hey, get over here. Like I know, like okay, like something's actually going on, and we're not trying to get a call. As opposed to the one where the ref's like standing over there, they're having a conversation, and then finally it's like, oh yeah, sure.
Yeah. I mean, I always tell people that I'll give everybody a courtesy stand, for their dramatic effect. I will give everyone a courtesy stand. I typically kind of just very similar to like basketball games. I'm going to run alongside a sideline. Maybe if I can get like a little bit closer. If I happen to be on the same side as the coach, sometimes I kind of mosey or I go and look at the coach because the coaches know their guys. They've seen them flop. They've seen their drama. They've seen their Oscars and their Academy Awards. So if another thing, looking at the coach, whenever I introduce myself at the beginning of the game, I tell the coach like, hey, listen, I know we're here to see like a great game. We might see some really great performances, but if you're really worried about one of your guys, one of your gals, go ahead and let me know, and I'll always go on the field too. So I might be like looking at the coach too. But everybody gets a courtesy stand. Everybody gets a courtesy jog, unless I see something that's major.
See, what I also like to do too is, I mean, obviously for the ones that aren't serious, like if it's like a big deal, okay, we're gonna get there a little bit faster. But if I'm getting called on, I'll do a little gamesmanship sometimes. If we're up, I might give my team, I might go a little bit faster, or if I think my team needs a little bit of a break, hey, we'll walk a little slower.
Because soccer time is arbitrary.
Well, no, sometimes, hey, the ladies need a rest.
Because soccer time is subjective. I don't understand that part of soccer. I'm sorry.
It's a start-stop. The official time is with a referee, and he typically has 2 watches to make sure he gets it right.
Yeah. And how come we don't get to know this information until the end? And how come it's a count up? How come they count up their time? I just don't understand.
Except I think NCAA does it different. I think they actually do stop the clock.
Like on the scoreboard?
Yes.
Really?
If I remember, it's been a while, but I think they do. Like NCAA does.
Okay.
Lorena worked NCAA for 8 years.
Yeah. We always did the countdown, the 45 to count down, and then at 2 minutes you stop the clock, and the official time is with the referee. And then once the 45 minutes is up, the referee is required to tell you how many more minutes is left, like 3, just like as if you were going to watch like a game. I mean, I haven't worked in C2A since 2014. I've been at the community college now for 10 years. And rarely do we even have like scoreboards that count. So it is really arbitrary time. I'm always asking my coaches how much time is left. But at the community college level or at the collegiate level, I haven't seen too much of like what you're talking about, Sandra, this arbitrary time. But there are some times I'm watching the World Cup or Copa or something, and I was like, 8 minutes, or like there was definitely stoppages, and they're like 2 minutes. I think that they are making things up at the higher levels. I think at this level, referees are just trying to get paid, do their job, and then get out of here. So I have not seen as much of what you're talking about as that arbitrary timekeeping as when I'm watching the World Cup, when I can literally like rewind and like probably play along with the referee and still have no idea where this 5 minutes came from.
So we do have, in addition to a cool one from Kevin, we have a gem from Jen. These are so special because if you guys are new, these are just really, really special stories from 2 really awesome people. And we actually had them co-host a story episode just like this one with Lorena. Our very first story co-hosted episode was with Kevin and Jen, and they did a hockey episode. It was obviously one of our best episodes. But anyway, we got a gem from Jen from this episode. And she says, I was told I'd be in charge of men's and women's soccer at a D2 school. I believe it was the inaugural year for women's soccer at the school, and the conference I had not worked in high school soccer level before, so everything was new. The takeaways that I had learned from the first season were many, but here are a few. When you are working with lots of players who, to say the least, dramatic, develop a system for them when they are really hurt, not just trying to draw the foul. It will save you countless spikes in your heart rate. I tell them to just lay there quietly as possible. If they're still, I know it's something I need to act on. It works pretty well for me. Soccer players are always surprised by the fact that they have 2 calf muscles when you show them how to stretch the deep one. I learned how to prioritize injuries when I had 2 players go down at once as a result of a collision in my 3rd ever game.
There we go.
I also learned that it's okay to warn an athlete that they're going to test positive if they're randomly selected for the drug test you know is happening that week as a result of the drugs they use to help set the broken nose from above collision. Inevitably, there are 1 or 2 players who buy new cleats the day before preseason starts and are surprised that they eat their feet alive. Lastly, soccer players take better care of their boots than they do themselves.
Fair.
That's pretty fair. That's pretty fair.
I thought you would like the calf one, Lorena.
Oh yeah. It's amazing how many times people are cramping And then sometimes they can just jump right back up, by the way. I like to use my invisible cold spray through like my eyes and just be like, get up, you know? But yeah, also seeing their teammates stretch them is just like really funny.
Yes.
Oh, yep.
Yeah. It's like, I like walk over there. I was like, mind if I take over? Mind if I'll let you guys be the expert at soccer, but like, can I, you're doing it wrong.
Okay. So, this is kind of actually the last section I saved the best for last. I saved all the injury stories for last. I thought people would like to wait on that, build up some suspense. So I did ask about the most common injury you've seen working soccer. By far, surprisingly, actually, to me, I thought it was going to be knee injuries, ankle sprains.
Yeah.
By far, followed by hamstring.
Yeah.
Followed by groin, hip injuries, concussion, knee injuries, and then some runner-ups: broken wrists, turf burns, and blisters.
All the above.
Yes.
I think
soccer in a nutshell.
As a soccer athletic trainer, it's a collision sport, so anything like any contusions or concussions are going to happen. It's collision, so people take you out, like literally try to take out your legs. So ankles get caught underneath, caught in turf, caught in grass. And obviously everybody's favorite, whether it's men or women's soccer, like the ACL. Fun fact is, when I first started at like my first full-time job at a university, I worked women's soccer, and I was like, oh my gosh, like I'm so afraid of the ACL. As a former soccer player, there's just something about like ACL that is just always going to be scary to me. Like I always tell people, I don't like telling people that they tore their ACL. I get almost, it just hits differently. As a former women's soccer player, I feel like it's been ingrained in us that we're going to have to be like worried about that. And the first 3 years at that university, I had no ACLs.
Nice.
Like no ACL tears whatsoever. Not anything that I did, by the way. I'd like to take credit for a great prevention program, but I didn't have that. But and then I think it was year 3 or year 4, I got slapped with 4 ACLs in 1 year, including all 3 of my captains of that year. Yeah, actually, a great quick ACL story is the fact that my starting goalkeeper went out with an ACL. It was like her second or third time at that point, so no surprise. And then my backup keeper during warm-ups tore her ACL. So then we put like our third string. This wasn't in the same game. It was just a couple games before, tore ACL. A couple games later, my backup keeper. And then we're about to go up to Santa Cruz, and third string goalkeeper gets a concussion. So then we're going up there, and we took a field player to go into goal, like on this road trip. And during warm-ups, she gets an AC sprain because she doesn't know how to dive.
Yeah.
And she tries to play in the game, and that doesn't really work.
It's just a bloodbath.
Yeah. It's kind of what soccer's about. It's a bloodbath. 90 minutes of collision. Ready, set, go.
So Katie L says she had to call 911 for a humerus fracture. A gnarly fall over an opponent onto their elbow and snap. They were down bad. She says, fortunately, I watched it happen, so I saw what happened, and it was truly one of the grossest noises I've ever heard. He was probably about 40 yards away. You could hear it in the recording from the camera to the top of the press box. She was having neurodeficits, so I activated EMS and waited for them. So I did ask on our Instagram story, have you ever had to call 911 for a soccer injury? And 52% of people said yes, and 48% said no. I was actually kind of surprised by that. I figured that it would be higher, that more people would have called for soccer.
Yeah, seriously.
Especially because I think this is the perfect time to share how the last 3 times that Randy and I have gone to Red Lobster, which we don't go to the Red Lobster that often, But the last 3 times that we have gone to Red Lobster, I think it was 3.
Yeah.
Yep.
We've been in the parking lot on our way to go like to date night, and Lorena calls us and is like, I had to call 911 today at soccer. Like literally, and
Yeah.
I think the second time I was like, oh, that's weird. Last time we were at Red Lobster. And
Yeah.
then the third time I was like, this is unreal. Like, I think we should stop going to Red Lobster because actually we haven't been since the last
Actually,
time
yeah.
because we're like, well, we can't go
Thank
on a
you.
day that Lorena
Thank
is
you.
working soccer because this is obviously not ending well.
No.
Yeah. Tuesday, you guys are not allowed to have date nights on Tuesday, Fridays during soccer season. Thank you, and I appreciate that greatly.
I think
it's funny,
the last time I think you were like, oh, I had a kid coughing blood, like he got hit in the chest and he was coughing blood.
That's a good
That
one.
was a good one. That was that's probably like if you were to ask me about my 911 story, that would definitely be it. That would definitely be it. Just once again a collision. One of my guys just it was a playoff game, and this kid was like mouthing off. These 2 guys were going. My guy and this guy was just mouthing off to each other, and I think my guy had had enough of his lipping, so he basically just the guy went up, and my guy led with his shoulder just right into the sternum, and the kid goes down. And one of those things where like everybody kind of looked like, okay, you need to come out here. And I get out there and he's laying on his side and he's just like struggling to breathe. And I was like, okay, you got hit in your chest, obviously. Like kind of started talking to the guy. And then the kid was just like, starts doing this like little cough. And then it kind of gets a little guttural. And then he just spits blood. And he's just laying on his side, groaning, spitting blood. And I turned to my student and I was like, I think we should call. So it was just a lung contusion. But during that whole time, just I kept him on his side because he was breathing well. He got hit on the left side. He was laying on the left side and he kind of had his arm underneath him, but he was in a nice, comfortable position. We took breath sounds and everything was normal, but something about coughing up blood made it feel like it wasn't quite in my scope anymore.
Yeah.
And then, of course we're like sitting there and I always like to be like smiley and kind of be personable with them. And I made the mistake of making the kid laugh probably 1 or 2 times, just kind of making jokes like I do. And I learned that if somebody has a chest contusion, you probably shouldn't do that because I think that at least one of the times he coughed blood was because I was cracking a joke. So decided that maybe I should keep my sideline act on the sideline for that. But yeah, that was put the red in Red Lobster for sure.
So some other weird injuries. I asked about the weirdest injury people have had in soccer. Christa H said superior shoulder glenohumeral dislocation.
Whoa.
It was the last couple minutes of a women's soccer game. One of the players had a foosh mechanism, came running over to me, bent over holding her shoulder. I reached under her shirt to feel for the humeral head and felt it sitting above the AC joint. It literally felt like the bony models we had in lab. Luckily, her pulse was normal, no neurological symptoms, and she was stable. Her dad drove her to emergency department about 2 miles away. It was reduced there. No anesthesia or anything. No torn muscles, labrum, no broken bones. Range of motion restored and full strength returned and no pain either. She returned to play about 2 weeks later.
Holy smokes.
Wacky.
Wait.
Right?
What? That is an anatomical anomaly. Like, I don't even understand that. Yeah. I realized that the shoulder has like some mobility. I didn't know it had the mobility to like for the glenoid to go north for a while.
Seriously.
Wow. That is a crazy injury for sure.
Right?
That's right.
I think that the craziest injury I had was one that just didn't make sense. So I had a men's soccer player and he just put his foot out to like kind of stop a pass and this guy just rocketed a ball right next to him and the kid put his foot out and then his foot was up in the air and then he kind of got like spun, not like spun a lot, but like you could tell that like his foot took the brunt of that pass. So, you know, 80-mile-per-hour ball goes through his foot, and then he goes down clutching his right knee. And so I go out there, you know, and he's screaming. So I didn't wait for anybody. I definitely went on the field, and I was just like where the ball hit, or he's like, my knee. I was like, where'd the ball hit? And he said, it hit my foot. And I'm thinking, okay, like right foot, put it out. It's probably like MCL injury. So I was like palpating the, like on the inside. He's like, no, it's on the outside. And I was like, it's on the outside of your knee? And I was like, oh, like, was it before you stepped? Like, did you step and then put your foot? And he's like, no, like when the ball hit, like my knee hurt. And so I got him off the field, and he really was, he didn't have any range of motion. He was trying to like move his knee, and he's like, no, it hurts too bad. This kid was also a little bit of a baby. I'm just going to like, he'd had a couple injuries before, and then they turned out to be like a little bit better with cold spray or whatever, a little bit better. So I kind of took it with a grain of salt that this kid was in a lot of pain. So I was like, all right, let's try to move it around. I palpate again. And it was like lateral joint line. And I was like, are you sure you like didn't like plant like right before? He's like, no, it's like the ball hit like my toes. And I was like, it hit your toes? And he keeps pointing like where the ball hit, just like right at the base of the first. And I was like, okay, well, let's get you on the bike. Let's try to get like range of motion. And he's like, I can't do it. Turns out that this kid managed to get a bucket handle tear of his lateral meniscus from the tibial rotation of a 80-mile-per-hour ball hitting him.
Dang.
So literally,
that's crazy.
He couldn't bend his knee because the meniscus had torn and basically flipped up into the joint. But it was an open chain, like lateral meniscus bucket handle tear.
You don't see that that often.
No, and the surgeon, I was there when he went to go see the doc, and the doc basically took like the leg model and was like, so if you turn your lower leg like this and you catch it at just the right angle, you can tear a meniscus like an open chain. You can have a meniscus tear. And he's like, I've never seen it flip up into the joint, so that was a first for him. And this is an ortho that had been working. This guy was old. He'd been working for a while, and it's the first time he'd seen that injury, but he was like, oh yeah. And that, I thought that was crazy. Yeah. Who knew?
One time I was called down to soccer, and it was because the coach called for a shoulder dislocation. And my co-head was all jealous because I was like, oh, I get to go put back a shoulder. Well, I get down there and the shoulder's already put back. So I was like, oh, like whatever. So I was like, well, I made it down here. I might as well just hang out and talk to coach for a little bit. So talking to coach, and all of a sudden there's someone like screaming down at practice. So then I was like, I'm going to go check that out. So I like walk over to the kid. And of course all the guys are kind of like backing up because he's like rolling. He was actually rolling. And it was his foot. And so I was like kind of like palpating, and it's literally right before playoffs. And I think it was their last practice before playoffs. And I was like, oh man, I think this is one of our guys. So then I'm like trying to palpate and figure out what's going on. He said that he had gotten kicked. So at this point, like, he's really not letting me touch it, like palpate much. And so I was like, you know what? Like, if you're that tender, I'm going to send you for an x-ray. So send him off for an x-ray. Talking to coach, I was like, you know what? Like, he's going to be in the boot at least for the weekend, or like the next day or two, just no matter what it is, just so he can like let it rest for a little bit. Turns out it was a dislocated first metatarsal.
Crazy.
From getting kicked.
Ooh. Wow.
And it just happened that I was down at practice, because our practice is a little bit of a drive, like down a hill, and then like across a parking lot. It was a little bit of a drive, with the golf cart, but it just happened that I was down there for a different dislocation. And then while I was standing there, that happened too. And it was like literally practice ended right then.
That's crazy. There's so many times that people catch a cleat on the top of their foot, like in soccer and everything. It's so hard. It's so hard. It's really hard to determine, like, if that's a bone bruise. Is there actually like a crack, in one of the bones of the foot or something? But like a dislocation. That's
yeah. I don't think he played.
Ah, bummer.
I know.
Yeah.
Dang.
And he was one of the guys.
He was. I think he was one of the. I mean, I didn't really work soccer, so I'm pretty sure.
Yeah, but helps with the story.
Yeah,
he was one of the guys.
Speaking of cleats, we got an anonymous one. This athlete got cleated in the face. Completely shaved off the lower teeth between the canines. It was not bloody. The athlete was just freaked out. I sent them immediately to the ER and instructed the athlete to breathe through their nose to limit pain due to nerve exposure.
Man, that's brutal.
Yeah.
Yeah. Those cleats seem to be sharp sometimes. I guess to get at the right angle, whatever. Definitely so many cleat marks. So many cleat marks I've seen. Especially when people don't wear their shin guards, surprisingly.
Huh. Actually, this is a perfect one to go in with the shin. Leah P said tibia proximal shaft fracture. It was many years ago, but I believe he collided with another athlete's leg. I remember hearing it when it happened.
Oof.
I also remember the kid being very calm. I think he was in shock because it was visible that there's a deformity there. He was in pain, but definitely a little shock also. I put him in a vacuum splint and it was just me, so I wasn't going to be able to get him off the field on my own and the golf cart, so I ended up just calling the ambulance to come get him, and our hospital is about half a mile away, which is convenient. And they just took him there and ended up having to put a rod in. I saw him about 6 weeks later and he was walking with crutches. I do think that he ended up playing again. He played for a different school though. I'm not exactly sure. He may have just played a little recreational.
Oh, okay.
Yeah, those tib fractures, by the way, it sounds like two wooden blocks hitting. It's a very unmistakable sound. Tib breaking. I've only heard it once, but I've heard it described multiple times. It's kind of like the Achilles tear when it's like, oh, I got kicked in the back of the shin. The sound of two wooden blocks hitting is very accurate for the tib fracture that I saw.
Ooh.
Yeah. You know, I've heard tib fractures in soccer. I also feel like I hear you talk a lot about the athletes, like just sounds, like you talked about earlier. I don't remember what you said earlier. You said something about listening for something, but then you didn't mention, but you've mentioned in person a lot before, the sound of when someone tears their ACL, like the sound that they make.
Yeah. I think specifically for women's soccer, I've had a lot of ACL tears, and there's like a yell that I don't want to say it's just what women make, but like there is like a sound that I have heard multiple times when someone has torn their ACL, and it's just it's a different kind of like yell, and like honestly, even thinking about it right now, I get like the chills because I don't like ACLs. They're haunting, you know. But I definitely, there definitely is a sound. I'm not saying that every woman that has torn their ACL has made this sound, but I do remember I have one on video, and I show it to my students, and I was like, that is the sound. I don't know how else to like describe it. And it's typically the non-contact ACL. When you when there's a collision, I think it kind of gets lost in there somehow. And females have far more, in my experience, have had far more non-contact ACLs, and it's an eerie sound to me, because I really do feel like there is a sound that I associate with that injury, kind of like that wooden block, for sure. So.
A couple other crazy ones we got. Keeper dislocated her jaw from a shot to the face.
Ouch.
It's a former keeper that hits a little home.
Then I got another one for you. Keeper kicked in the face. Bottom lips were stuck on braces. No tooth injury.
That actually happened. Yeah, that's happened to me.
That's
That's
brutal.
a personal story.
Oh.
Yeah, that's a personal story. I
Ouch.
just didn't have wax that day, and apparently I just wanted to go for it. But yeah, having to pull someone's lip off of their braces is quite unique, quite embedded in there.
Bilateral patellar tendon avulsion fracture.
Wow.
Dang. That sucks.
Steve J
Dang.
says, "Hi guys, I just want to share a story about a soccer injury. One of my players was challenged from behind during practice and was forced forward onto flexed knees. When he hit the ground, both of his knees fractured at the tibial tuberosity, causing the tendon to rip the bone further away from itself. Air casted, called EMS, and had surgery the next morning. Thankful to say he has made a complete and full recovery and is once again competing with his team, about to enter his senior season of high school."
I want to know about the groundskeeper that maintains that field. Like, no, that sounds like cement. Like, oh my gosh, that sounds horrible.
Yeah.
That should not happen. You should not fracture both your tuberosities just falling.
Wow.
I guess it was either that or his PCLs, right?
Yeah, that's true. I think you'd rather take the PCLs.
Yeah, I don't know. Bilateral PCL. That's some loosey goosey. I don't think I want to run on legs that don't have a that back cruciate, right? I know. Technically you can play without it. Apparently, you can play without ACLs too, according to me. But
I know I did not expect that to be the theme of this episode at all. Actually, I don't even know.
No.
I don't think I knew that you have had anyone play with a torn ACL.
The other girl that played in her senior game, she just rehabbed for 3.5 months. She worked hard, and she just played 10 minutes. She was a midfielder, though, so she could only go like 10 minutes. We didn't let her like run on top, and she pulled herself out. But like I said, that first one, just an amazing human being.
For sure.
Mm-hmm.
I wouldn't recommend it, though. It is still an unstable knee, and it is soccer. But I've also had athletes. I've never had an athlete personally that I've seen, but one of my athletes has said that they tore their ACL in a game and they continue to play.
Whoa!
I've had an athlete say that they didn't know that they had torn their ACL until after the game was over. And she
I've
was a
known
midfielder.
that about PCL, but I haven't heard that about ACL.
Yeah,
No,
I had.
Yeah,
one of my basketball guys. He got hurt last year, and he felt like, because I didn't see it where I was standing. I just saw him go down, and he was saying like, "Oh, I felt it like buckle like laterally," and so I looked at it and looked more like LCL. I didn't necessarily get anything that made me concerned about the ACL, and I taped him up. He actually was hopping and running. He didn't end up going back in the game, but he was fairly functional. But yeah, it turned out he tore his ACL. It was crazy.
Yeah. I mean, I wouldn't recommend like someone tearing their ACL and they go back to play right away. But I mean, the body is adaptable, right? The body can do some amazing things, and I still to this day don't quite understand how those players could be field players and play.
Mm-hmm.
And once again, one of those like favorite memories is just this person was physically and just overall just an amazing specimen of a human being. But they could like push themselves through it. I mean, I think when I talk to her about it, she jokes that like, well, they stuck me up front, so I can kind of just be playing around and doing my own thing instead of in the back trying to make some crazy tackles, saving goals. So she knew her limitations. So she wasn't playing at the level that she used to, and she just dialed it back. But once again, I mean, we were doing some really great proprioceptive rehab and landing techniques, and body adapts. It's crazy. We've all seen the body do things that we didn't think it was possible, and I think it just takes a special human being to like do that. It's definitely the exception and not the rule for me.
Mm-hmm.
Someone tears their ACL, I'm like, you're not playing with it. Reconstruct it. Let's go. But just happen to be in the right situations every once in a while that had a doc have enough faith that it's the right call. So
Okay, I know this episode's getting a little bit long, but I want to ask
Mhm.
one more thing because I think I totally overlooked it. I did ask about when it comes to soccer practice modifications, how people
Mhm.
felt about if they don't know where to start or if it's like easy peasy. It looked like on the slider, most people answered that they were closer to the easy peasy, kind of like that, like 75% mark, like 3/4 of the way between those two. Um, so I want to know how you progress someone back into practice after injury. Evan J said the way he does it is simple drills, passing, then non-contact, small-sided games. So, for example, like 6v6, 7v7, just not full field, and then he goes into full go.
Yeah. Yeah. I think for me, it starts with a good running progression. Like soccer is an endurance sport. So once I can get them to do some single leg stuff, get them through some type of functional testing, uh, maybe not 95%, but like something beyond like an 80% functional test, I'm gonna have them start to run and have their body start to adapt from of just that like running, and then once they can start running, we do like a good sprint progression. I love build up sprints where somebody starts at 0 and they can kind of give me subjectively, like, okay, I want you to do 6-yard box, 18-yard box, 50, and then go the full 120. Tell me at like what percentage can you get up to? And then just subjectively, they're telling me that. And I want to do that. Once they can start to do some build up sprints, then they can start doing some, possibly, it depends on what position they are, maybe some passing patterns, maybe some defensive drills with like non-contact, just moving side to side, change of direction. But until they can really get to like a full sprint, I'm not really liking if they're doing some full cuts or like the 7v7s or 11s. Once they can do once they can move laterally and they're about 70% of a sprint progression, I feel like they can go into like some rondos, which is just like quick change of direction. Maybe that's just 1 or 2 steps to the side. Put them in the middle, and then they're not very good at rondos, but they can at least try. And then really for me, they're as much as possible at practice. If they're not in something, they're doing laps or they're keeping their cardio up, because that's the number one thing in the sport is you have to have the cardio and the endurance to do that. So if anything, it's just keeping that running progression in the back, build up sprints, and then going into contact once I feel like they can do like a sprint at like a 70%, then that's like a good change of direction. But mostly I do like a lot of, like I said, the 6-yard box, 18-yard box, 50, 120, and then just some cone drills. I always like, we have blaze pods at my current job, but we haven't used them as much. So I just go for the old school cones. And I don't really go out to practices all that much, just because of where I work. So talking to my assistant coaches and telling them like different kinds of cone drills and agility drills, to do, yeah, kind of where I go.
Actually, I was just talking to our strength coach about this because
Mhm.
when we're returning, so for summer, for example, for football, I don't go out to practice, but I have a lot of hamstring strains and groin strains, your typical preseason stuff. And I feel like it's so hard for me to transition in the summer when I'm not going out to practice,
Mm-hmm.
because they don't have that accountability of me standing out at practice and being like, okay, you're going to do this build up sprint. You're going to do flying tens. You're going to do this. You're going to do W drills. You're going to, whatever it is that I'm having them like do, that I feel like I actually think about, and I was actually talking to our strength coach about you and how you do it with soccer, because I feel like all the sports that I've gone out to.
Mm-hmm.
And so like I'm able to be right there. So that accountability is difficult, especially for someone like me who doesn't really work soccer that much, and not knowing what part of practice. It could really help getting like that assistant coach involved and saying like, hey, I need you to be accountable. Hey, I need you to run them through these drills, et cetera, et cetera.
Well, right now we have a former player working with us that went to Cal State Fullerton, got his master's in movement and kinesiology. So he's really been like a great help this year. Like I said, after hiring a great third, I've been able to do a lot more prevention programs. I've worked on like a hip flow that we've like mastered, and then I was able to do kind of like a ACL prevention for both of our soccer teams. And he's been really instrumental in implementing that. But if anything, just taking one of the assistant coaches aside and just being like, hey, this is what I want to do. Because really the treatment times, they need to be out at practices. The guys or the girls, they don't get to duck practice and be in the athletic training room with me for the most part with any of the sports. So I need to find a way to incorporate them into practice or to keep them engaged in practice or doing something. So I feel like I've done a good. I've adapted pretty well in finding what can you do at practice, and if you're not doing something at practice, here's your alternative, because you don't get to just stand by the sideline. You're not getting movement is medicine. We got to like get you moving in some way. So with soccer it's pretty easy. Just run, just go run, or do like ball touches, passing patterns, be the passer in the drills and stuff. And then, I mean, that goes without saying, as far as mentally, it goes a long way for an athlete to be standing on the sideline versus actually being engaged in a practice. And I really believe in the mental side along with the physical. So anything I can do to get them incorporated into practice. And then if I couldn't, then they have homework. I just had a guy who had a hamstring strain back in March, wasn't able to do very good rehab. And for the last month and a half, we've been trying to figure out if he's going to redshirt or not from this hamstring. And we had to start it at ground zero with him because he did no rehab and he had scar tissue and really couldn't sprint past 80%. And he had homework every single night. He wasn't able to do everything, but he had homework every single night. And we'd talk about the drills and we'd lay out cones and we're like, well, this is what you're going to do. And I think it just takes like good communication, and obviously you have to have an athlete that is bought into you and trust that this homework is actually going to pay off. Right. But that goes to one of my foundational principles of just, they don't care what you know until they know that you care. So if you get an athlete to buy in, they'll do any rehab exercises you tell them to do. So yeah, there's that.
Awesome. Was there anything you feel like we didn't hit in the soccer realm?
No, just kind of knowing kind of that the substitution rule. There's actually a couple. You had mentioned substitutions or like when somebody has to be subbed out, and the exception to the rule is the goalkeeper doesn't have to come out. If you can always go on the field, and the goalkeeper never has to come off. If a player is fouled and a yellow card is given, the player who got hurt doesn't actually have to come off of the field.
Oh.
So if the result of the play is an injury and a yellow card was given, right? Or if two players on the same team collide, they don't both have to come off. Also, that's one of the things where the referees, you'll find referees that adhere to that or that don't, maybe just have them step off, and it's like, or they make a judgment call. I found that, I don't know if this is true for you, Randy, but referees love to come up to me at the beginning of the game and be like, okay, so like, you're going to have to wait until I call you onto the field. And it's funny because it's the same referees I've seen for 10 years now. And, I think they stopped giving me a spiel at some point because I was like, listen, if it looks like I need to do my job, I'm going to go ahead and do my job. But I'll let them roll around a little bit until you tell me. But, I think I've definitely been in situations where I was like, I'm pretty sure you're supposed to be subbed. And I've had referees randomly be like, oh, it's fine. But so I had to like look up, I've had to look up the rules, but the general rule is if you go onto the field, the player at least has to step off for like a second. But there are some like FIFA exceptions, and at our level, we go by FIFA rules. But then again, we always joke whether or not referees actually know the rules. I'm pretty sure our coaches yell at referees all the time. Referee,
Referee!
They know the rules. Referee! Yeah. So, anyways, that just quick substitution. But if in doubt, ask your coach. Hey, like, is it okay if I go on? Coach says you go on. Go right ahead. So, I think that's it. I think that's all I got. It's fun to talk about soccer. We could probably talk a little bit more, but this is a long episode. I don't know if everybody shares our enthusiasm here.
Yeah, I'll leave the soccer to you guys.
I'll take it.
I'm excited.
I'd be wearing my World Cup jersey. I'd be wearing my jersey right now if I could. Anyways, yep. That's all I got. I think there's no extra time. We can call the game.
Yep.
You know what's funny? This entire episode, I did not mention that the first time that I've ever gone to playoffs with one of my own, I guess it wasn't really my team, but I've traveled to playoffs with a team was women's soccer.
Oh, that's true, huh?
Mm-hmm.
That's pretty cool. See, my thing is, like I said at the beginning, every time we talk about this, now I miss soccer.
I know, you really do.
Yeah.
It is one of your favorites. Randy and Lorena could talk about soccer for probably hours and hours.
Hey, we were locked in on the Olympics. We had each game ready. We were ready.
They really did. And so we do have so many more soccer memories and soccer things to talk about, I'm sure.
Oh, for sure.
Was there anything you felt like you needed to add before we kind of close it off?
No, I think we did a really good job in that episode, or like just that discussion with Lorena and sharing stories. I think we pretty much covered everything. I can't think of anything that I'm like, oh, we missed this.
If you guys think of something that you wanted to add or something that you think you learned working soccer, make sure you head over to our Facebook group, facebook.com/group/AT Corner Podcast. There's only one question to get in. Where did you hear about our podcast? And it will automatically add you to the group. You can network with other listeners, etc., etc. We also do every episode as either a story episode like this one, an education episode. We also do continuing education units. Thank you to our partner, Athletic Training Chat and Clinically Pressed. They've been awesome in bringing those to you guys. Some of them are free, so make sure you go take advantage of those. We have everything down below in the show notes if you're interested in that. And speaking of CUs, while we're here, you can use code ATCorner for $150 off MedBridge.
Hey, if you get it now, you'll have it for the full, like a full year. So going into the end of the cycle next year.
Yeah, but I think that's all the fine print I got.
That's perfect. Thank you for helping us showcase athletic training behind the tape. Bye.